Today we are going to study about resuscitation of a newborn baby. After the class we will be going to understand about how to assist a newborn baby at birth. To perform basic resuscitation of a newborn baby with using standard equipment, resuscitation is a special situation that is in mechanized liquor and preterm birth. To learn principles of aftercare for a baby who requires resuscitation at birth. The key words include anticipation, preparation, help, record, fast, gentle, warm, hygiene, mother. We will include these words in following lectures. First is preparing for the birth. For preparing for the birth, we have to do hand hygiene. That is washing our hands. The room should be drought-free, warm room, temperature of greater than or equal to 25 degree, dry, clean, warm, delivery surface, radiant heater, 2 clean warm towels and cloth, a foldable piece of cloth, self-inflating bag, newborn size, infant mask 2 sizes, normal and small newborn, suction device, oxygen if available, cloak. Check all the equipments are in working order. Delivery assessment at birth include deliver the baby on mother's abdomen, note and call out the time of birth, thoroughly dry the baby, use a warm towel, discard wet towel after drying, wrap the baby in another warm cloth, keep the baby warm, assess the breathing while drying. Care of baby at birth, assess breathing. If the baby is crying, no need for resuscitation or suctioning. Start skin to skin contact and breastfeeding. If the baby is not crying but breathing at 30 to 60 times per minute, no need of resuscitation or suctioning. Baby is gasping, start resuscitation immediately. Baby is not breathing, start resuscitation immediately. Now we can check on a scenario. The mother arrived at your maternity hospital and delivered a baby girl. As soon as she reached the labor ward, the placenta was followed by baby and mother was not bleeding. The baby was pale, he was breathing and her rate is 120 per minute. What is the action? Dry the baby immediately after the birth. Then immediate skin to skin contact, breastfeeding care. Then only routine care is required. The baby who is crying, breathing normally. Even routine suctioning is not required for the normal babies. Now we can look on the next scenario. The baby girl is born at your clinic after second stage 60 minutes. Umbilical cord is short. You can see the skin is pale. She is not breathing. Heart rate is over 100 per minute. What is the action? If the baby is not breathing or gasping, call for help. Cut the cord quickly and transfer to a firm, warm surface under the radiant warmer. Inform the mother that baby has difficulty in breathing. You will help the baby to breathe. Start newborn resuscitation. Position: clear airways. What is the correct position? Correct position we can seen as in the picture. Not hyperextension or flexion. There will be hyperflexion. Position: clear the airways. First mouth we have to clear, then nose. Do not exceed duration of 20 seconds. Then dry, stimulate and reposition. We have to dry the patient. We have to stimulate by touch or sound, anything, and reposition the client. Remove the wet linen. Dry, stimulate, reposition. Stimulating by touch or pain stimulate, anything. Dry, stimulate, reposition. We have to do this, and then ventilation. For ventilation we require a bag and mask equipment. Size of the bag 240 to 750 ml. Oxygen capability, oxygen reservoir. Safety feature: pop-off valve, pressure gauge. Ventilate. Use the correct size face mask that covers the nose, mouth and tip of the chin but not the eyes. Fitting the face mask. Face mask should not be too large. It should not cover the eyes or it should not be too small. Ventilate, use the back 2 fingers for the whole hand 2 to 3 times. If chest is not rising, the chest will be rise after we giving this resuscitation. If not rising, we have to check the seal. If any air is leaking or not, reposition the head skews harder. Once a good seal and chest rising, ventilate at 40 squeezes per minute. Observe chest rise, check heart rate after 30 seconds. Bag and mouth ventilation is required for a baby not breathing or gasping. When to stop ventilating? If baby is crying, if breathing greater than 30 per minute and no chest injury, if the skin between the ribs is suckled inward and ribs are prominent, the baby has chest injury. After stopping of ventilation, put the baby's skin in contact with the mother's chest. Monitor for 15 minutes for breathing warmth. Tell the mother that baby will probably well. Encourage mother to start breastfeeding as soon as possible. Never leave the baby alone. When to continue the ventilating if the breathing rate is less than 30 minutes per minute is gasping or severe chest injury present, arrange for immediate referral. Referral, explain mother what happened, say that her baby needs help with breathing, ventilate during referral, record the event on a referral form and labor record. If the baby is not breathing, even after 20 minutes, stop ventilating. We can look on a next scenario, that is a baby girl born at 38 weeks following thick corneal stained amniotic fluid noted, B limb and not breathing. Baby's blue, not breathing, heart rate 80. What is the action? No need for intrapartum suction. Bertha assess heart rate and breathing tone. If heart rate is greater than 100, good breathing, good tone. Initial step, non-vigorous, any parameter abnormal, tracheal suction should be done. According stained, depressed baby needs endotracheal suction prior to bag and mask ventilation. Routine suction of the oropharynx is not recommended before delivery of the shoulder. Mother admitted in maternity unit delivered a baby boy, 32 weeks of gestation. The baby is not breathing. If baby is pale, not breathing, heart rate is 80. What is the action? That is a baby is a preterm. What are the special consideration for a preterm baby? In case of resuscitation, be gentle. Use small size resuscitation bag and give small tidal volumes to move the chest. Avoid 100% oxygen. Use blenders and oxygen saturation monitors. Avoid rapid fluid bolus. May need intubation, chest compression and medication. Keep the CPAP backup ready. Preterm babies, birthing breaths need special precaution before during resuscitation. Post-resuscitation, keep the normal temperature, maintaining oxygenation, maintaining physiological minimum fluids and glucose, maintaining the perfusion, treating the seizures, monitoring organ function. Care after resuscitation. Place the baby in skin to skin contact with the mother. Keep the baby warm. Monitor every 15 minutes. Start breastfeeding as soon as possible. Discuss what has happened with the parent. Be positive. Do not separate the mother and baby unless the baby has difficult breathing. Keep the baby warm. Radiant warmer. Open the airway. Position the baby's head so slightly extended. Suction the mouth and then nose. If still not breathing, ventilate. If breathing or crying begins, stop and ventilation. If breathing at less than 30 minutes per minute or there is severe chest injury, continue ventilation. If no breathing or gasping after 20 minutes of ventilation, stop ventilation. Explain events to mother and documentation.